Welcome once again. This is Anthony, an IT specialist from Assignment Uganda. You can contact us on 0773 660977. I'll be taking you through the Cashier management module as part of the Medicsoft Plus, the system which has been developed to simplify and manage operations in a medical facility. So, under the cashier mainly will manage patient bills, will be able to view the revenue, how much has she earned in terms of cash and in terms of a debit. She'll be able to see the dates, the recurring dates, and be able to receive the money from these debtors. Should be able to record expenses, should be able to view expense reports, should be able to view the diagnosis that has been done by the doctors in a day. Why? Because when she's giving out medication, she might need a prescription of what the patient is supposed to get. So let's begin by recording one new patient bill. Let's assume that this patient is the person who has just come to the clinic or to the pharmacy or to the medical center to acquire drugs. So, when this patient comes to the medical facility, first of all, she is recorded in the system by the receptionist or by the cashier herself. So already we had a patient in who was Linda Ruth. So when you're under the new patient bill, you select the name of that patient, then you say under create bill, you click on initiate. When you click on initiation, if this patient was diagnosed, you would have seen the results here. But as per now, let me say that she has maybe come for a test plus some other items. So let us assume maybe she has come for HIV testing. When you select it, it will automatically show you the charge for that test. Number of counts, it's how many times does she want to make that test in that very day? It's probably once. When you put in once, the system it will calculate the subtotal. Then you tell us whether it was on it's being paid in cash or in invoice. Let's assume this patient will pay cash. After selecting cash, the receipt number, it is automatically generated by the system. Then you press process. And press that, it will now start adding items on that receipt. So far it has added HIV testing. Let's assume that this patient wants to also maybe make a blood test. Blood test, I see it's at $18,000. If this facility can deduct, here a cashier has an option of changing the figure. You can say she will only test once, which will be a subtotal of $15,000 to be paid in cash, and you can process that payment. And then let me say maybe the patient is also taking some drugs. Here, a cashier will come to add items, select amoxicillin. Remember the selling rate. It was set under the settings by the administrator. And then quantity, how many tabs is this person taking? Maybe only 2. 2 times 200, it will be 400. Then select which store is losing. Let's use the main store because most drugs were allocated to the main store. And then tell us, are these on cash or in invoice? Let's say it's on cash. Prescription, it's optional actually, because sometimes it is on the it would be written on the packet where these tablets are put. Add to bill, so it will be also added to bill. It's under items and these are under services. So the grand total, you can see 15,000 plus 5,000 plus the 400, that's 20,400. The cash has an option of printing a receipt. So this is a receipt, so it can bring the receipt preview. So this preview is for the mini receipts, the receipts which are output by the POS machines. So apart from that, when the cashier comes to today's revenue, automatically she will see how much money has she made that day. So it's showing that the grand total was 20,400. Invoices were 0. She has not received any payment from the date, and she has not. She received only cash, which is 20,400. Here in the front, if she has made a sale of a service, we have options like make a request for service. Let me say this patient came to test for HIV. Now it's up to a cashier to allocate to send that patient to the laboratory. When it's a blood test, it can maybe also to the lab or to the scan room. So a cashier can come and say, let me send this patient to another department. She can send her to the laboratory, and here I see the status has changed, and it will show the cashier that indeed the patient has been sent to the scan room. Same way, she can also send this patient to the to the laboratory. Send, so it will change the status now to sent to lab. So it means the lab plus the scan room, it will only receive patients who have been sent in by the cashier, because it is the cashier to receive that amount. Now, under the dates, we've not given out the dates, but they are managed fully by the system. Expenses. If maybe the cashier makes an expense today, let me say it was under Yaka, maybe it's been incurred today, which is 18th. She will select that item, go under date incurred, select when it was incurred, and put the amount. Maybe let's say it was 20,000. Press enter to be saved. If another expense was made, maybe under garbage, same date, maybe garbage it was taken for $5, can also be saved. And you see the system, it will keep on totaling up the expenditure made on that very day. Under the expense report, the cashier is able to check the amount spent on specific items in a specific period. So I can check from which date to another date, and I can say view report, and it will show me one item. It was Yaka, this was that $20, which we have just recorded. Number 2, it was on garbage, and garbage, the expense was 5,000. So in summary, a cashier will always work on the patient bills, view the revenue, record the dates, date payments, plus invoice, plus items that have been taken on an invoice which result into dates. She will record expenses, she will check for expense reports, and she can also produce to the revenue report. Thank you for watching. Let's meet in the next episode, which will probably be about the laboratory and the scan room. See you.